A national shortage of a common ADHD drug has been expanded to include a fourth strength, putting the spotlight back on major medicine shortages across Australia. More than 430 medications are currently unavailable or in very short supply, and there are warnings another 60 are about to be added to the list.
Small tasks can feel like big hurdles when Kate Ritchie doesn't take her medicine.
A really bad day is struggling to get out of bed, struggling to come up with a plan for the day.
The 27-year-old has attention deficit disorder, which she's usually able to control with a drug called Vyvanse. But she was recently told her script couldn't be filled due to a nationwide shortage.
So I started calling around to other pharmacists and they didn't have any. I think I called 30 to 40 pharmacists.
It's a situation Susie Hopkins worries she could soon be in. She carries her Vyvanse on her at all times, so she doesn't forget to take it.
It's made a staggering difference to every area of my life.
The registered nurse and ADHD coach is prescribed a high dose of the drug, which at this stage is still available. But she fears what would happen if the strength she requires ran out, including how it would affect her business and her 9-year-old son.
I'd be late for pick-up and drop-off, and I would forget to remind my son what he needs to take to school. The worst bit is things like leaving the house unlocked and leaving hot plates on.
More than 430 drugs are currently included on the Therapeutic Goods Administration's national shortages list. Around 60 more are expected to be added in the weeks and months ahead, including medicines for Parkinson's disease and rheumatoid arthritis, as well as a common antibiotic used to treat urinary tract infections. Pharmacist Adele Tehan is delivering disappointing news on a daily basis.
It won't be available till mid-April, and even then we don't know for sure.
She always tries to offer solutions, but sometimes they cost more.
That's the alternative. Okay. The difference is this one is not covered on the PBS. That means patient will be penalised financially for something that they haven't done wrong.
When a product is unavailable, pharmacists often have to send people back to their GP or specialist to change their prescription.
It is causing a little bit of additional work. Anytime that we find that we're having to redo a script or redo a medication, that is extra time for us, but it also can be frustrating for the patients.
Pharmacists are calling on the government to remove the red tape that often prevents them from offering patients alternative medications to ensure they get the treatment they need.